Thank you for joining us. This is a discussion with Dr. Adarsh Bhimraj, who is an infectious diseases specialist at the Cleveland Clinic Foundation in Cleveland, Ohio, in the United States. The purpose of this discussion is to look at various treatment options available for COVID-19. I'd like to point out again that our goal is to shed light on the information that is available to us here in the US. We are not making specific treatment recommendations for any given patient. That's up to their treating physicians wherever in the world they are. So shall we start with one drug which has a lot of good data behind it, which is corticosteroids?
So whether we're looking at corticosteroids and we will be looking at a few other medications and drugs, a very important question to ask, not just as a doctor, but even as a patient or if somebody else that you know is sick, is when a doctor or even a press release or something says a drug works, what do they mean? Right? A lot of these drugs can kill a virus in a petri dish or can make some blood work of a patient look good. And we all presume that is a good thing. But at the end of the day, the drug should save lives. If people are dying, it should prevent them from dying, or it should significantly decrease the suffering, right? What do you mean by suffering? And again, if you're that sick enough, you have to get admitted to a hospital, or if you need a breathing machine, oxygen, that is suffering. So can drugs actually prevent that? So you'll find a lot of confusing data in the press, but the question you should be asking of others and yourself is simple. Does the drug alleviate human suffering or save lives? So let's get to it. Which of the drugs which have shown that by far out of all the medications that have been studied, corticosteroids are the drugs which have been shown to save lives. But we have to be very careful about, like, it saves lives only in people who are very sick enough to be admitted to the hospital, either requiring oxygen or a breathing machine or a mechanical ventilator. If the disease is that severe, corticosteroids have been found to actually save lives. But if the disease is very mild, that is, it's just in the nose, or even if it's in the lung, they're not requiring oxygen, and your oxygen levels, when you can check on your finger, they're not dropping. In fact, the study shows that starting steroids might slightly even be harmful. It might even, again, the numbers were not big enough to show, but they might even be harmful or causing death. So I think if you're not admitted to the hospital or if you're not very sick, steroids might be slightly harmful and they're certainly not beneficial. But if you're sick enough, you're admitted in a hospital or need oxygen or need a breathing machine, steroids are helpful. That distinction is very important, Madhu, because now everybody's getting steroids even as an outpatient, but I don't think that is a good idea. It is only for really sick ones.
Because not all COVID patients are the same. I'm a critical care doctor. I take care of the sickest patients in the intensive care unit. And then there are those who've just had a RT-PCR positive and may have minimal symptoms. So these are two ends of the spectrum. And then we have in between patients who are at home, fairly sick, but their oxygen levels are still intact. There are those oxygen levels are dropping. Maybe they need to get to the hospital, then a little bit more sicker, oxygen levels have dropped. Maybe they're in the low 90s, high 80s, requiring more oxygen in the hospital. So it's good to have you draw this distinction that steroids, and I'll just reiterate what you said, work in the sicker patients, not those with mild disease. Steroids can be life-saving. They've been shown to be life-saving in this group of sicker patients. If it's a very mild illness, steroids don't have a place in the treatment of COVID-19 in such patients.